The USAID President's Emergency Plan for AIDS Relief (PEPFAR) program is working towards a target of transitioning 70% direct funding and implementation to local partners to accelerate progress towards epidemic control and achieving PEPFAR 95-95-95 goals, as well as build local capacity to ensure locally led action for sustainable solutions. Accelerating support to advance local partners, ASAP, is the USAID's global mechanism supporting USAID PEPFAR localization effort. ASAP has been supporting local partners to have the capabilities and resources to serve as prime partners for USAID PEPFAR programming in compliance with USAID and PEPFAR procedures. These two strategic objectives guide the work and activities undertaken by ASAP. The first objective is to strengthen local partners as they transition to receiving PEPFAR funding as USAID prime partners, ensuring they comply with regulations. The second objective is to prepare local partners to directly manage, implement, and monitor PEPFAR programs, maintaining consistent achievements and quality. To achieve these objectives, ASAP conducts comprehensive organizational capacity assessments with local partners using NUPA's PLAS tool. These assessments identify key capacity gaps that need to be addressed to ensure these organizations can effectively receive and manage U.S. government funds. Here in Ethiopia, ASAP began working in 2019 with 10 selected organizations. Based on the landscape analysis, USAID conducted the Integrated Service on Health and Development Organizations, or ISHDO, was among the local partners selected for ASAP technical assistance. ISHDO has experienced a remarkable transformation using the technical support from ASAP. ISHDO has been elevated from a sub-awardee to a USAID prime partner.
ISHDO, as indigenous civil society organization established in 1997, focused on HIV prevention, care, and support activities. This was established by 3 individuals, volunteer individuals, dedicated individuals, who were touched by the rampant days of HIV/AIDS during that time. ISHDO developed its portfolio from HIV/AIDS prevention to other development initiatives. In this case, education, peace and development, conflict management, gender transformation has been included to the HIV prevention initiative. That made to change the name ISABSO into ISHDO. ISHDO is known by donors and international organizations living in Ethiopia. ISHDO is known for its commitment, engagement, dedication, and quality of work. ISHDO is particularly targeting the key and priority population. For this reason, we had a lot of donors and support groups here in the country and outside. Currently working on 4 projects with amount 5.6 million, supported by 4 different donors. Plus this, we are working with 2 big projects supported by USAID. One is through PSI Ethiopia, the other 19.3 million USD is as a prime partner directly from USAID. We are working with 4 regions and other 2 regions, Gambella and Oromia, which are highly populous and highly affected regions of HIV. ASAP and ISHDO are started working together from 2019 after USAID Ethiopia introduced us a technical assistant. We signed a memorandum of understanding and decided to work to manage ISHDO capacity building. Since the ASAP support, ISHDO's capacity is increased in different aspects, like the funding is increased from 150,000 USD to over 5.6 million USD. The staffs is increased from 30 most probably to 200 staffs currently in different regions as well. The scope of area and the number of beneficiaries all are increased. This is made possible only through the support of ASAP.
With the support of ASAP, after we are capacitated, we found another grants or funds from different organizations, particularly from Global Funds, the Minas Fund, and other organizations from EU as well. So we have got donors and funders, and we use the money properly to address our community in different aspects.
ASAP support has been very instrumental ASAP support has started from the assessment to identify the gaps using the NUPAS assessment tool. The NUPAS assessment tool is this very comprehensive tool which addresses different thematic areas in terms of organizational management as well as program. It includes thematic areas like leadership and governance, financial management and internal control, monitoring and evaluation and quality improvement, human resource management, procurement, and logistics management. So ASAP initially has done a NUPAS assessment in a participatory way, which includes the staff of ISHDO as well as ASAP staff. They sit together to identify the gaps based on the developed tools. And they have, through that assessment, they have developed a tailored capacity building plan for ISHDO. There are different areas that has been identified as a gaps. In terms of financial management, there are a number of gaps in cost allocation, financial documentation, payroll management and preparation. In fraud management, ISHDO lacks policy on fraud management, reporting and risk management. And in terms of human resource management, there is a huge gap on personnel file management, payroll preparation, and doing reference check for the newly hired staffs. And in terms of monitoring and evaluation, there are gaps identified in terms of supervision and data quality management. Another important gap that has been identified is the mandatory standard provision, which is a core for USAID program implementation. There are lack of policies on misconduct, conflict of interest, non-discrimination, and these kind of policies were not available with ISHDO. So ASAP helped ISHDO team to address these gaps through different means. The main means that they have been using were training, mentoring, coaching of staffs with embedded technical assistance, providing templates and customizing policies and guidelines. There are a number of webinars that have been organized by ASAP and with different thematic areas, and our staff has been involved in many of the webinars that have been organized by ASAP. We also need to do a NUPAS assessment to our local implementing partners. So all our staff has been trained on how to do a NUPAS assessment and on program management, leadership and governance training has been provided to our board members. Quality improvement has been one of the critical activities that we have received support from ASAP. So we have managed our programs, quality improvement activities through the support that has been provided by ASAP.
I wish ASAP would continue, because capacity building is not like just to something that you finish anytime you want. But we understand that we are good enough now to really train our sub-partners, and yet the support, if the support continued, I wish it would have been good, but we are doing our best in doing the same capacity building to our sub-partners and other local NGOs when they question us to do so.
ASAP, in fact, gave us a training on board management. So from there, it helped us refine and also revise what we are supposed to do as a board member. It's supported, in fact, in a very many ways to rearrange the whole board in a subcommittee, 4 subcommittees, which looks into governance, resource management, resource mobilization, and networking, and others. After having that subcommittee, in fact, we worked very much with the organization and also with board members, and in a way, how to strengthen in these areas, how to contribute in these 4 areas, and many more. So revised our terms of reference and also job description for the subcommittee. The training helped us to see things as a whole for the organization's prosperity. Working and contributing to the people. And one thing we did was to develop a job description for the subcommittee and for all subcommittees. And we also developed self-assessment and organizational assessment tools. And we also looked into how we are doing things in a manner that contributes to the organization.
ASAP's ultimate goal is to ensure that local prime partners are not only capable, but also resilient and self-sufficient. By empowering local organizations, the program aims to create a lasting impact on the health and well-being of communities across Ethiopia.
ISHDO provide technical support for our sub-grantees, including by providing training and different materials like Excel-based tools that help them to have a good and efficient, sound financial management and internal control system.
Currently, ISHDO is managing 7 implementing partners as part of the family-focused activity and being a prime partner to USAID. And we have been following the model that has been provided by ASAP. So depending on the baseline assessment that we did with our implementing partner, we have developed a tailored capacity building plan. So based on the tailored capacity building plan, we have been working with our implementing partners to find a solution for the identified gaps. Throughout the 3 years implementation period, we understood that most of the identified gaps have been improved among our implementing partners.
Through this expanded network, ISHDO is making a substantial difference in community health, ensuring that the vital resources and support reach those who need it most. The journey from a sub-awardee to a prime partner underscores the power of collaboration and capacity building fostered by ASAP. Now, ISHDO is leading the charge, sub-awarding 7 local partners across 2 regional states. Their reach has expanded significantly, now encompassing 7 regional states and 53 towns. This impressive growth highlights the organization's strengthened capacity and the far-reaching impact of their work. Through the collaboration and dedication fostered by ASAP, USAID, and PEPFAR, are paving the way for the future where local partners lead the charge in ensuring a healthier and brighter future for all.